Welcome to Girl Talk with Dr. Anu Bajaj and Connie. Dr. Anu Bajaj, certified by the American Board of Plastic Surgery, by the way, one of the very few female plastic surgeons. A statistic, one of my favorite statistics, is that when you went into plastic surgery and got your board certification, how many percent of women were?
11%.
Only 11, which is strange because a lot of calls that I get, I'm like, so what drew you to calling us? And they say it's because you're a woman.
It's interesting because, we know that most plastic surgery patients are women. And traditionally, surgery's always been a male-dominated specialty. So I passed my boards in 2005, and at that point in time, fewer than 11% of board-certified plastic surgeons were female. Now we're in 2026, we're, I think, between 20 and 30%. But sometime in the near future, the tables are going to reverse, because right now we have 50% of plastic surgery residents in training are women.
Woohoo! So we're coming, but it was a challenge when you started.
When I started, it was hard.
Everything is set up for men.
In general, you have to deal with the usual headaches of people who think because you're a woman you shouldn't be doing surgery, or people who want to discourage you and tell you you'll never have a family, you'll never have a life. But there's also a lot of other things that we don't think about surgery and women. And one of them is surgical instruments are designed for male hands. My hand is much smaller than a man's. I mean, let's just be honest.
It is.
And so, in general, surgical instruments are designed for men. Like if you want to do orthopedic surgery, for example, all the drills and saws that they use, I could never hold them when I was a resident because they were too big.
Right. Your hands have gotten a lot stronger. But also, it is still a benefit. On the flip side is you have tiny hands, so you can sew tiny blood vessels, and I've had patients tell me they feel more confident with you sewing on their face because they don't have clumsy man hands sewing all over their face.
One thing that's interesting, when I did my fellowship at MD Anderson, the chairman of the department there actually said that he thought women were better microsurgeons because they had small hands.
Yeah, I agree.
I thought that was interesting.
And being a female plastic surgeon is not a marketing gimmick either. So I'm going to say, I thought maybe we should talk about marketing gimmicks, right? There are so many things that we do because we believe in them, optimal outcomes, patient safety, all of that stuff. And you're just doing them because it's the right thing to do.
Right.
But then we see, you get on social media and there will be these buzz terms. For example, the way that you ensure advanced, smoother recovery, advanced recovery, and helping that experience from preoperative through postoperative. What do you call that?
I call that part of the surgical process. The buzzwords today are buzzwords like rapid recovery, minimal or no. I think that's the big buzzword. Yeah. But all of these programs are built on our data that we've accumulated over the years on enhanced recovery after surgery protocols, and also the concept of prehabilitation for surgery. Right. Which aren't necessarily buzzwords because they don't come out of the mouth as easy. But
enhanced recovery after surgery. ERAS, we tried to make it kind of catchy.
And ERAS has been around for about 20 years. It was actually developed in colorectal surgery as a way to optimize the recovery for all of those big surgeries. And then we've adopted that. And then the other thing we've learned over the years is that having surgery is like training for a marathon. And, I haven't run now in 3 years. So if I were to run a marathon tomorrow, it'd be the stupidest thing ever. And it's kind of the same thing for surgery. Yeah. You have to prepare for surgery if you want your outcomes to be optimal.
And it's not emergency surgery. This is elective. So there are so many things that we and our patients can do to enhance the overall outcome and experience?
Yes.
Like?
So the things that we need to do is adopt a high protein diet with 90 milligrams of protein per day. And that has clearly been shown to improve wound healing and recovery. Your body needs all of that stuff to heal. The other thing that is also been shown to improve recovery is you need to start building your muscle mass and strength training. Because
you gotta recruit the other things.
Yes.
Like tummy tuck patients, you gotta work on those glutes and quads because you can't use your core. How are you gonna get on and off the toilet? These are things you don't really want to think about, but it becomes a real situation in those first couple of weeks after surgery. So even though it's temporary and it's a small piece, and sure, maybe the outcome would have been the same regardless, but there's a lot of value in that experience in those first couple of weeks post-op.
I do think it makes a big difference for your recovery. Let's backtrack a second.
Okay.
Connie had her eyes done. She followed all the rules. She drank water. She did not drink wine. She did arnica. You ate your protein.
I did. I was doing the Premier protein shakes 3 times a day. And seriously, like some people don't have a problem backing off on their alcohol intake and other people have more of a struggle. I think I was somewhere,
But either way, her surgery went smoothly. She hardly had any bruising.
Right. And even during my procedure, you guys were commenting about how little I was bleeding during the surgery. And driving home, I had to stop at the pharmacy to get my ointment. And I was like, I looked up in the mirror, I'm like, oh, my swelling hadn't even set in until I woke up the next morning. That's when I had the swelling. But
it didn't even last that long. It was short-lived.
Yeah.
Let's go back to the fact that I was not a rule follower. I had the same procedure done. I had bruising and swelling and more bleeding during surgery.
But she had a fun time because she was drinking wine. I had no fun. But yes, I had been preparing for mine. You also kind of capitalized on a timing situation.
That's
Sometimes
true.
you gotta, when it's time, it's time. And when it's accommodating, that's another thing that's important to me in my role here is helping people accommodate surgery into their lives. We don't need to force a square peg into a round hole.
Yes, it has to be at the right time, the right place, the right surgeon, the right staff.
And when
it just feels right. Yeah. It's sort of like dating, I guess.
How did you know? Well, when you know, you know. Yeah, so I think that our patients that are drawn to us, they just gotta know. It's in their gut. We're very relationship based. We're not trying to churn and burn.
You go to a plastic surgeon and pay twice that. But the problem is that people think of Botox as the product and that they think that that's the same as what the plastic surgeon, the board certified plastic surgeon is injecting. And while the product may be the same, the care, comprehensive analysis, everything else is different. So if you're looking for the cheapest, then you're going to do your Groupon and your $8 unit Botox.
Yeah.
If you're looking for a more comprehensive approach, you're going to go to the board certified plastic surgeon.
Right.
And I feel the same way about surgery. Like going and having a surgery just because it's $3,000 or the $5,000 breast aug isn't necessarily the right thing, right? Because it's surgery.
It's surgery. You get one body, and so you have to consider what the value you're giving up. I think. I would go, what are they skipping? What are they not doing? It's because it's got to come from somewhere.
Well, it's got to come from somewhere, and you also probably don't get the same degree of relationship building. I mean, how many patients have you had that have said to you, I've called a lot of offices, and yours, nobody spends as much time with me as yours does. How many people tell you that?
Many of them. They're like, wow. I had a girl just the other day say she was going to have to pay the full consult fee for somewhere, and their consult fee was the same as ours, $150. And she said, but they wouldn't give her any information. It was, you have to pay that even to just get in the door. And how does she know she's a surgical candidate? How does she know her goals are realistic? How does she know what to expect?
How does she know that she's in the right place?
Mm-hmm. Yeah. And you have to pay that just to find out. I was like, well, I'll give you all that. I think that knowledge is power. I think it should be accessible. I think that this content that we do when we do these types of things should be out there in the world for women to have, so that they can make informed decisions.
And, you know, all of our posts and social media and newsletters are geared towards education. Like, the interesting thing is so I had a post-operative telehealth visit today.
Yes.
And I asked the patient, well, do you have any questions for me about how things are going and so on? And she's like, nope. Every question I've had, I have found in the information you gave me.
Yay!
I was like, what? And she's like, yeah, I just go back to my pre-surgery packet, or I go to your social media and watch your videos, and all my questions get answered. I was like, oh, wow.
So what we're doing is working. That's amazing. I love to hear that, because then sometimes we make them like, is anybody even reading this?
I know, because they are kind of detailed.
They get a little wordy, but we do use bullet points. So I feel like, you know, for some people, if you like the words, they're there.
That's
If
true.
you want chunks of paragraphs, but if you don't, you've got bullet points. Just kind of hone in on
the bullet points.
Well, I think you learned a lot about us in this in today's episode. A nice little kind of recap for people who might be just finding out about us or wanting to know more about Bajaj Plastic Surgery. So I think we'll wrap it up for this episode. Thanks for joining us. Here we are at our Girl Talk, where confidence looks good on everyone.
Have a great day.